And when we look at vaccination rates, I assume these are still being tracked somewhere. I remember the days when we used to put up on the screen during the pandemic how many Australians had been vaccinated that day, and we were all very focused on that. In terms of people who aren't in that older age group that you just referred to there, are many people staying up to date, or has enthusiasm really been waning as time goes on?
Oh, very much waning. So there's only a small percentage of people who you would say were completely up to date. If you say up to date being two injections a year for people at significant risk, then there's less than 15% that would be filling that. So now we're well behind, and we look really, because the virus is behaving in a relatively benign fashion, I'm not saying that we need to go ahead and have boosters. Look, for me, I've been infected 4 or 5 times this year because we just see so many patients with COVID these days, incidentally, often as incidental findings. And, you know, I haven't been sick with it, but there's no point in me having a booster because I've just been getting the virus so often, so which a lot of us in healthcare that see lots and lots of patients each day do get. So we're getting natural immunity, natural protection. And of course, people out in the community are counting the virus all the time and not even knowing about it. So at the moment, with our current status, I honestly do not think that it's a big deal to go out and get COVID booster vaccinations, unless you, as I say, you feel like doing so. I'd never stop you from doing it. And you do fall into defined risk groups.
And now, Clay, from our chats in the past, I know that you've been a bit of a long COVID skeptic. I saw some research out recently suggesting that the virus can persist in our bodies for years after infection. Do you think the average person needs to be concerned about that scenario you just mentioned, you getting the virus 4 or 5 times this year, about the impact that that can have on people's health longer term as we all do start to notch up more and more infections over the years?
Yeah, and look, there's a number of viruses besides COVID that can cause chronic infection and persist in the body for years. And just the respiratory viruses like flu and paraflu, RSV, etc., can persist and cause long-term symptoms. You know, that viruses just can do that. The trouble with long COVID is completely poorly defined. There's a number of different diagnostic criteria, but they're all very, very loose. So we don't have a single tight diagnosis to be able to make this. So it's nothing like 5 or 8 or 10% of people that get COVID have long COVID. That's completely and utterly overstated. So there's a very small minority of people that have persistent symptoms. I'm not denying that, but a number of other viruses can do it as well. So look, for me, having been infected multiple times, I feel fine. I'm just getting old and tired and grumpy, but that's got nothing to do with the virus itself. It's just from working 70 hours a week and trying to deal with all the other health issues that we do face. So I am not at all concerned, Ash, about Christmas or next year going forward. I don't see anything bad on the horizon at the moment, and the news is all pretty good.